I want to talk today about pelvic organ prolapse. Pelvic organ prolapse is a condition that occurs with women where after they have vaginal births, their insides can fall out. Sounds unpleasant, and oftentimes it is, but oftentimes it's not. So I wanted to explain what this is. This is a cross-section of the woman's body. This is the front, and this is the back. This is the uterus, where a woman has her vaginal deliveries. This is the bladder where a woman pees from, and this is the rectum where a woman poops from. When a baby's head is coming out through the vagina, it can cause the ligaments that hold the organs of the pelvis. It can cause the ligaments to weaken. And then as years go by with gravity and with exercise, changes in weight, damage from childbirth, organs can fall out. And the organs that typically will fall out will be the bladder will drop, the uterus will drop, the whole vagina will drop, the rectum will drop, and then also the intestines, which are not pictured here, will drop. Symptoms that a woman can experience with pelvic organ prolapse include pelvic pressure, bladder leakage, a sensation like her bottom is falling. Some women with pretty extreme prolapse of their rectums have to touch their vaginas or put pressure on them to have bowel movements. A woman can feel a great deal of heaviness during her cycle. She can feel discomfort with sexual activity or even laxity, a loss of sensation. So with anatomical problems, the ultimate treatment is a surgical correction. Surgery can be done in a minimally invasive way, and there are other things you can do other than surgery. The common thing that women hear about are Kegel exercises, which are just exercises to strengthen the pelvic floor. That is squeezing the muscles that you would use to prevent yourself from passing gas or leaking urine, and just holding those, contracting those muscles as often as you can, or just holding them as long as you can, and just building that up over time. That definitely helps, and it doesn't hurt. It's not going to be 100%. There's also pelvic floor exercises and pelvic floor physical therapy that can help a lot. And then there's even some exercise devices such as an Apex machine that can be inserted in the vagina that can strengthen the muscles as well. Surgical evaluation includes a physical exam and an ultrasound. We specialize in minimally invasive surgery to correct the exact problem that's bothering a person, which can include, which sometimes requires hysterectomy, but oftentimes doesn't. Oftentimes we can fix the prolapse, put everything back in place, and get a patient out of the hospital the same day or the next day, and have her back to driving again within a week or two, and back to normal marital activity, sexual activity within 6 to 8 weeks. So if you have symptoms of pressure, a sensation like your bottom is dropping, bladder leakage, problems with bowel movements, heaviness with your cycles, please come in and see us so we can do an evaluation and we can educate you about your options. Thank you.